Histology of fibrocartilage. Introduction. Welcome to today's lecture on the histology of fibrocartilage. Fibrocartilage is a specialized form of connective tissue found in various parts of the body, characterized by its unique structural and functional properties. In this lecture, we will delve into the microscopic features of fibrocartilage, its mechanical properties, anatomical locations, its role in repair and regeneration, and its association with various clinical conditions. So let's begin our journey into the intricate world of fibrocartilage. Fibrocartilage is a type of cartilage that contains both fibrous and cartilaginous components. It is characterized by the presence of fibroblasts, chondrocytes, and collagen fibers. The fibroblasts produce the collagen fibers, which give fibrocartilage its strength and resilience. The chondrocytes, on the other hand, are responsible for maintaining the extracellular matrix and synthesizing proteoglycans. Under the microscope, fibrocartilage exhibits distinct features. It appears as a combination of dense collagenous tissue and cartilage. The collagen fibers are arranged in bundles, forming parallel or interwoven patterns. The fibroblasts are elongated and sparsely distributed among the collagen fibers. The chondrocytes are usually found within lacunae, scattered throughout the tissue. The extracellular matrix shows variations in density and composition, containing proteoglycans, glycosaminoglycans, and water. The unique composition and organization of fibrocartilage contribute to its mechanical properties. The collagen fibers provide tensile strength, allowing it to withstand tension and compression forces. The arrangement of collagen bundles gives fibrocartilage its resistance to shearing forces, making it suitable for load-bearing structures. The presence of proteoglycans in the matrix enables fibrocartilage to absorb and distribute forces, helping to prevent cartilage damage. Fibrocartilage is found in various locations within the body. It serves as an important component of intervertebral discs, providing cushioning and stability to the spine. It is also present in the articular surfaces of synovial joints, such as the knee and temporomandibular joint, TMJ. Additionally, fibrocartilage can be found in structures like the menisci in the knee joint, the pubic symphysis, and the tendons where they insert into bones. Despite its limited capacity for regeneration, fibrocartilage can undergo repair processes. In response to injury or damage, fibroblasts and chondrocytes proliferate and migrate to the site of injury. They synthesize new collagen fibers and proteoglycans to fill the defect. However, the repaired fibrocartilage may lack the organization and structural integrity of the original tissue, leading to compromised function. Osteoarthritis is a degenerative joint disease characterized by the breakdown of cartilage. Fibrocartilage plays a significant role in this condition, as it can undergo degenerative changes, leading to further cartilage damage. Loss of fibrocartilage in the joint can result in pain, inflammation, and functional limitations commonly associated with osteoarthritis. The temporomandibular joint, TMJ, is a unique joint that relies on the presence of fibrocartilage for its function. TMJ dysfunction, also known as temporomandibular disorder, TMD, can involve structural abnormalities or damage to the fibrocartilage within the joint. This can lead to issues such as jaw pain, clicking or popping sounds, and restricted jaw movement. The menisci are fibrocartilaginous structures located within the knee joint. They act as shock absorbers and help maintain joint stability. Meniscus tears are common injuries, often requiring surgical intervention. Surgical techniques aim to repair or remove damaged fibrocartilage, depending on the severity and location of the tear. Intervertebral discs consist of fibrocartilage that separates adjacent vertebrae in the spine. With age and repetitive loading, these discs can undergo degenerative changes. Fibrocartilage degradation and loss contribute to disc degeneration, leading to conditions like herniated discs and spinal stenosis. When tendons attach to bones, fibrocartilage forms at this junction to provide a smooth transition. In cases of tendons injuries or surgeries, the formation of fibrocartilage is crucial for proper healing and restoration of tendon-to-bone attachment. Understanding the histological features and repair mechanisms can aid in enhancing the healing process. Like other tissues in the body, fibrocartilage undergoes age-related changes. These changes involve alterations in collagen composition, reduced cellularity, and diminished ability for repair and regeneration. Age-related changes in fibrocartilage can contribute to the development of musculoskeletal disorders and compromised joint function. Sports-related injuries often involve damage to fibrocartilaginous structures. Traumatic events, repetitive motions, and overuse can lead to the degeneration and tearing of fibrocartilage within joints. Athletes in high-impact sports are particularly prone to fibrocartilage injuries, which can have long-term implications on their performance and overall joint health. In conclusion, the histology of fibrocartilage presents a fascinating interplay between fibrous and cartilaginous components. Its unique composition and organization confer specific mechanical properties, allowing it to withstand tension, compression, and shearing forces in various anatomical locations. Fibrocartilage plays a critical role in joint function, repair processes, and the development of clinical conditions like osteoarthritis and TMJ dysfunction. Understanding the histological features and functional aspects of fibrocartilage aids in the diagnosis, treatment, and prevention of related pathologies.